So also thank you to you, Malati, for the initial nice introduction. When I learned that I was allowed to speak here on this conference on enforcement, I thought of what might be of interest to a mainly Indian audience. And I learned that I had to speak on enforcement of pharma patents in Europe. And so I decided that I would pick on the topic of second medical use claims and their enforcement in Germany, because there have been some recent decisions in the last year which may be of interest to especially the Indian pharma industry. Before I do that, however, I would like to briefly just remind you of the European situation. We have already seen a lot of slides on these, so I'm going to be quick on those. On the European situation and the way it is currently dealt with. So here you see a map of Europe with the European Patent Convention member states. 38 member states, and the European patent is granted centrally by the European Patent Office, whereafter it will then subsequently need to be validated in individual countries if the patentee was interested in those. For this validation process, he has to fulfill certain requirements, like in certain countries, Spain and Italy, has to prepare translations, etc. And in other countries, translations of the specification. In other countries, he has to not fulfill any other requirements, for example, France, Germany, and UK, because their claims would have already been translated into the respective national languages during the grant procedure at the EPO. So what you end up with, essentially, is then we have already heard this this morning from Dr. Karl, from my German colleague here in the plenary session, a bundle of patents, bundle of national patents, centrally granted by the European Patent Office, and then at the decision of the patentee, having been put into force into individual countries. So how is this? And what we are not talking about, but I still like to show this slide. I'm not going to talk about the European unitary patent, which is still music of the future, but I still like to show you this slide because I always like J.R. Tolkien, Lord of the Rings, and I like to show you this one patent to rule them all, one patent to find them, one patent to bring them all, and in the darkness bind them. We don't have that situation yet, and your guess is as good as mine when this will enter into force. I would think likely to be only in 2017 at the earliest, because of certain referendum that are still going to take place in the UK. In Germany we will have elections in the near future, and so it's not entirely clear when this European unitary patent will go into force. But so we have to deal with the situation of a bundle patent. And the bundle patent means that when you deal with litigation, you deal with this on a national basis. And what I've shown you here is basically the relevant stipulation of the European Patent Convention. So infringement and litigation is dealt with under national law, and the national part of a European patent is dealt with for this specific country with this specific national law. I've also shown you here the map of Germany, and with two blobs here. And these blobs are not detonations of some bombs, but these are the locations of two cities in Germany where two major courts are situated with respect to infringement. That is the city of Düsseldorf here and the city of Hamburg. And I'm going to introduce you to some of the case law of these respective courts, because they are important infringement litigation courts in Germany. Now, coming to the actual subject, second medical use claims. I'm sure most of you, or if not all of you, are familiar with the fact that you can patent second medical indications based on different scenarios. So you may, for example, have a new indication where it was known, as an example, that you can use aspirin to treat headache, but it was not yet known that aspirin also dilutes your blood and therefore is useful in preventing you from getting a stroke or a heart attack. So that would be the sort of most obvious case of a second medical use claim where you would apply for patent. Then there has been ample of case law, which I'm not going to go into, for new patients groups to be treated. There may also be a different technical effect, which may then itself manifest itself in a new clinical situation, where again you would treat a particular patient group in a particular manner. You may have a different dosage regimen, or you may have a different mode of drug administration. So you may, for example, instead of applying the drug in the form of a tablet, you may inject it, or you may ingest it in the form of a bolus. So all of these scenarios are patentable under European patent law, and of course then you have the question, how do you deal with these claims when it comes to litigation? The typical format that is used in Europe for these claims is either for older patents the so-called Swiss type format, which you're probably well aware of, the use of a compound X for the manufacture of a medicament for the treatment of a disease. And then since the advent of the new European Patent Convention in 2007, the compound X for use format, so which is either compound X for treating disease Y or pharmaceutical composition comprising the compound X for treating or preventing disease Y. And again, the question arises, what is the claim scope of these claims? And there have been a number of decisions, but before that I'd just like to make a general remark. When it comes to interpreting these claim formats, you must of course always weigh the balances between the interest of the innovators, who, as we have heard this morning from Dr. Dressel and others, have to heavily invest in research and development, versus the interest, also understandable, of the public to gain access to affordable medicines. So on the one hand, there's the interest of the innovators to get some return on investment, because otherwise they would not heavily invest in their R&D activities. And on the other hand, it should not be misused as an instrument for, this is the term that I learned whenever I started traveling to India, evergreening patents. So fair balance has to be struck. Now, the first line of case law that I'm going to introduce you to is the Ribavirin case law from the District Court of Düsseldorf, where at stake was a second medical use claim in the Swiss type format, which was directed at the use of Ribavirin for the manufacture of a pharmaceutical composition for treating a patient having HCV. And then there was a certain administration time period, and the Ribavirin was associated with an effective amount of interferon alpha, and the patient was a specific subgroup of patients. The patient was one having failed to respond to previous course of interferon alpha therapy, so he was a non-responder, and he was characterized by genotype 1, and he had more than a greater viral load of greater than 2 million copies per ml. What were the alleged infringing activities? Well, basically this was Ribavirin capsules by a company sold in Germany, and there was a package leaflet which mentioned the treatment of HCV with using a Ribavirin monotherapy, so not in combination with interferon alpha, or the second possibility was a combination therapy with interferon alpha, but there was no mention of the specific patient group. And of course the plaintiff argued that there was either direct infringement or indirect infringement. And the case law that the District Court of Düsseldorf developed, or was based on higher instances decisions, which I'm going to mention you briefly on the next slide, is that basically there's this concept of evident preparation or manifest arrangement of the drug that must be fulfilled in order for such an allegedly infringing product to infringe the second medical use claim. So in the product somehow there must be some way that you can see that it was intended by the producer of that product to purposively realize the specific use that was claimed in the claim. What the District Court of Düsseldorf found was no, there was no direct patent infringement, because in the package leaflet of that particular product there was no mention of the specific patient group, and it was also not mentioned that the patient was a non-responder, and so the purpose of the patent claim was not realized in this particular product. Likewise, there was also no indirect infringement according to this decision, because the manufacturer of the product did not offer it for manufacturing, for an act of manufacturing. It was offered because it was to be used by patients itself. Now this concept of evident arrangement or evident preparation, here I've just summarized that. So it looks for some material manifestation in the manufactured product itself, the packaging, the label, the product leaflet, etc., the summary of product characteristics. So it must be somehow to be seen in the product itself, or its way it is arranged in the commercial field, that it was intended to be used in the way that is